So we'll go ahead and get started. Thank you all so much for joining us today. We're thrilled to have you. As always, if you're in a place where you're able to turn camera on, it's great to build community in that way, and we understand that that's not possible for everyone. We are thrilled to have today Saun-Toy Trotter, and I will introduce her in a moment. First, I'm going to talk a little bit about our CalMap program. Can we go to the next slide, please? Excellent. So we are CalMap. I think folks here know that by now. We used to be called CAP, but same program, just a new name. We are available for consultation, which is free. So if you're working with young people and you're a medical provider, you can give us a call or fill out this online form to request consultation. We have both general consultation from our child psychiatrists as well as specialized consultation with some of our psychologists. And next slide, please. Thank you so much. And then this is some information about our funders to whom we are grateful. All right, so I am thrilled to welcome Saun-Toy Trotter. We are so happy to have her today talking about racial trauma. And let me just get her bio to load, which disappeared for a moment. There we go. Saun-Toy was born in New York and raised in the Southeast. The Bay Area is her home for over 30 years. She is a healer and psychotherapist with over 20 years of experience providing trauma-informed and culturally responsive behavioral health care to adolescents and families. She has experience in school health centers, residential treatment facilities, inpatient and psychiatric units, and her practice is rooted in youth development principles. As the clinical director of school-age youth and adolescent programs at UCSF Benioff Children's Hospital, Oakland, she has expanded school-based services to include health education and youth advisory boards. Ms. Trotter is a contributing author to School Social Work, Engaging Social Justice and Racial Equity from Practitioners' Perspective. She has provided training and consultation for many child-serving organizations. She is committed to evidence-based and culturally rooted practices that foster individual and collective health, well-being, and liberation. She loves working in schools, and she is a mother, aunt, daughter, and spouse. So thank you so much, Saun-Toy, for being with us here today. And before we turn it over to you, we'll turn it over quickly to Lauren for a mindfulness activity, and then back to you.
Thank you everyone for joining us today. We did just want to acknowledge that, this is a particularly challenging time for many of us, given the work that we do and also the humans that we are in the current times. And so really appreciate you coming today. In that vein, our team also has been collecting some resources for what we call our Safe Spaces Toolkit. And these are just a library of resources that we've all been curating and gathering in hopes of supporting students in the current time. So please feel free to take a look at that. I'll also share the link in the chat. And with all of that, I thought, gosh, what would be a good mindfulness activity for me in the space that I'm in today? And I thought of the loving kindness meditation. And so some of you all may be familiar with this. There are, different links and kind of levels of intensity that you can do with loving kindness. We're going to do a pretty abbreviated one today. But to do this, feel free to turn off your videos if you would feel more comfortable. Get yourself in a comfortable position, and we'll start by just paying attention to our breath and breathe in, 2, 3, 4, hold, 2, 3, 4, breathe out, 2, 3, 4, 5. So continue with that belly breathing or box breathing. And we're going to start by sending good wishes first to ourselves. So if you feel comfortable, close your eyes. Imagine a version of yourself. It could be your current self, a future self, a past version of yourself. And repeat, send wishes to yourself, such as, may I be happy, may I be safe, may I be healthy, and may I be free from harm. Next, I'd like you to think about a close friend or loved one or colleague or student that you work with. I'd like you to picture them in your minds and focus on sending them good wishes. May you be happy. May you be safe. May you be healthy. And may you be free from harm. And then lastly, I'd like you to think about your community and whatever that means to you. And we'll end by sending some good wishes to our community. May we be happy. May we be safe. May we be healthy. And may we be free from harm. When you're ready, feel free to shake yourselves out, open your eyes, and bring yourself to the current space. And with that, I will turn it over to Saun-Toy.
Thank you so much, Lauren, for that. Mindfulness really was beautiful to receive and to participate with all of you. And I just want to appreciate everyone's bringing their time and their attention to this really important topic of how do we heal and how do we support our clients, our families, our communities to heal from race-based stress and trauma. The goals for today, we would like for you to leave here with being able to define racism, race-based stress and trauma, to identify strategies that school-based providers can use to address race-based trauma and promote racial healing in schools, and to identify strategies for caregivers to address the impact of racism on children and adolescents, as well as have resources for children and adolescents themselves to address the impact of race-based trauma. So there's so much to say on this topic, and we'll say what we can in the time that we have together. I wanted to begin with this image of Sankofa, which is a Twi word from Ghana that means to go back and get it. And also the Sankofa bird is an Ndrinka symbol that reminds us as we are moving forward into the future that we turn our gaze to the past and that we remember the lessons, the gifts, our ancestors, the painful moments, the joyful moments and celebration, and that we bring that with us, that wisdom and that knowledge as we are moving forward into the future. And welcome, Jessica. So as we are talking about any sort of trauma or stress, it is possible that our own systems and bodies may get activated. And so thank you again, Lauren, for beginning us with that mindfulness, and invite people to hold in mind an image, a thought, a safe person that you can return to, and remind you that you can always return to your breath and to the ground beneath you. And I'm also just sharing the 988 Suicide in Crisis Lifeline for you to have and share with your communities. If we were together in a room and had more time, we would start by locating ourselves. And so if you feel comfortable, I invite you to put in the chat the answer to some of these questions, which is your name, your pronouns, your race, ethnicity, and cultures. To think about what parts of your identity do you draw on as a provider, and to notice where you feel comfortable and where are your own growing edges talking about racial trauma, racism, white supremacy. And I will start and share just by introducing myself. I'm Saun-Toy. My pronouns are she, her, and hers. I'm a cisgendered Black woman. And I think when I thought about what parts of my cultural identity that I draw upon as a provider, it is both that the importance of relationship and connection, and then also my connection to spirituality and to ancestry. And that when I'm in the room or even before sessions or after sessions, it's what helps me hold as much trauma, pain, and possibility that I am called upon to hold as a provider. So just for yourself, take a moment. What parts of your cultural identity do you draw upon as a provider? And where are your comfort levels and growing edges? many of us are healthcare providers who work in schools, and holding that schools can be both a place of harm. Someone told me a story very recently of a kindergartner who was being told um, by others, right, that they were not good enough, that they were not, that there was somehow something wrong with them because of the color of their skin. We have a whole program called Spark, which was designed because of the disproportionate suspensions of Black and Brown children from preschool and kindergartners. So we know that schools can be a place where there's harm, but schools are also a place where there's healing. And as people who may work with in schools or work with people who are inside of schools, part of our role as providers is not only to create healing in our individual work with families or adolescents or children or in our group work, but also to provide mental health consultation, training, and support to capacity build and create and foster a place of healing and safety inside of the school. Anything I share is rooted in the principles of trauma-informed schools, and we want to recognize the prevalence and the impact of individual, interpersonal, community, and historical trauma, which includes racism and white supremacy, for everyone in the school community. And that's part of what we'll be doing today. And we're hopefully we'll walk away with some tools and inspiration about how can we actively disrupt, interrupt, and bring our knowledge of trauma, bring our knowledge of protective factors and healing into policies and our practice to foster resilience, recovery, and healing for all children and youth. These are the 6 principles of a trauma-informed school that was developed by Dr. Joyce Dorado and UCSF Hearts. And today we're gonna lean into the principles of understanding trauma and stress and cultural humility and responsiveness. So I think we may all hold a definition of trauma, but in order for us to begin in the same place, I want to share this definition and really holding that trauma is an event or events that is a threat or perceived threat, forgive the typo, um, that is a threat or a perceived threat or assault on a person. And that experience overwhelms the body's natural capacity to cope and creates some disintegration and disconnection and could leave one in a survival state of fight or flight or freeze or fawn and appease. And this event or trauma or stressor can be experienced directly or indirectly. So it's not something that has to happen directly to it. It's maybe something that we witness, hear about, know about. And really, when we think about racism, we think about kind of it being direct experience, but also inside of like a smog, kind of in the environment that we're in, given some of the messages that people receive. I really appreciate this image from Rise Youth Center in Richmond, California, which took the ACEs study, which was a large research study that was developed by Kaiser and the CDC to speak to and acknowledge the impact of childhood adverse experiences, things like divorce or alcoholism in the family or child abuse, and the impact on those early childhood experiences on the health and well-being throughout someone's lifetime. And what Rise Center did, and then later CDC and others adapted, was also hold the social conditioning and local context and bring in the generational embodiment and historical trauma that is part of the adverse experiences that children and family are growing up in and that their families are in. That includes microaggressions, implicit bias, epigenetics, and the ways that trauma is carried through the body. And that can lead to complex trauma, the overstress load, different ways of coping, including maladaptive ways of coping. But what we know is that ACEs is not destiny, and that the more that we're aware of some of these factors, the more we can actually begin to address and prevent them. So we talked about trauma, and I want to share this definition of racism by Dr. Kamara Jones and invite everyone to look at some of her work that usually uses the garden as a metaphor. And Dr. Jones shares with us that racism is a system of structuring opportunity and assigning value based on the social interpretation of how one looks, which is what we call race. Like we can all know and hold that race is not a biological reality, but it is a social construct that has real impact on the world in which we live in. And some of that impact is that it unfairly disadvantages some individuals and communities, while it unfairly advantages other individuals and communities. And in that, it saps the strength of our whole society through a waste of human resources. So when we think about race-based traumatic stress, it is important for us to hold that race in and of itself, one's race or one's culture, is not traumatic, is not stressful. So I kind of adapted the term rather than race-based traumatic stress to really we're talking about the stress and trauma of racism, the stress and trauma of white supremacy, and how that plays out on people of color and Indigenous individuals. And then inside of that, then the reaction and the response to threats, to harm, and to injury through those events and discrimination. And it's similar to post-traumatic stress disorder, but yet it's unique because it is ongoing, involves individual and collective groups. It is also something that is here before someone is born, throughout their lifetime, and after they die, right? So imagine kind of being born into a state where there's a potential of exposure to racism just based on who you are. Um, I will share a story of a family member that I know, who moved out of the country, right, with the hope that their brown child won't experience the level of racism that they would experience here, right? And we know it's insidious. We know that is everywhere, but really thinking about like kind of how even that as a parent's fear of I have a brown child, how can I best protect them? Can I, making moves around that. I want to always highlight Dr. Jo DeGruy and her groundbreaking work in the 90s around post-traumatic slave syndrome and really identifying the impact of race and racism on our bodies here, now, and today. And even though slavery has been a part of human history, American chattel slavery represents a case of human trauma incomparable in scope, duration, and consequence to any other incident of human enslavement. And so holding, again, Sankofa, we want to look back. We don't want to lose kind of the lessons. We want to pay attention to intergenerational trauma and that how that shows up today, not only in individuals in color, but also in white-bodied individuals in terms of how our society and institutions are shaped and how value is placed. Coming back to the trauma-informed foundation here, when we're thinking about a collection of people, if you think about the health outcomes for Black individuals, if we think about for Indigenous individuals, the high rates of suicidality, what we want to think about is not kind of what's wrong, right? Or is there something with this population? It's more what has happened to these whole groups of people, right? Chattel slavery, displacement, what has happened to this group of this community, and inside of that we can verify, validate those experiences and begin to see what is right, begin to root into the possibility, the resilience, the power of the community, and to share that with young people. Another factor is cultural humility, developed by Dr. Melanie Terverlan and Jan Mari Garcia, right here at Children's Hospital Oakland, which is a lifelong process of critical self-reflection, using reflection, and we can use reflection as healthcare providers in our consultation to identify power dynamics in our patient-provider relationships, and that we can honor our expertise that resides in community as well as making sure that we're continuing to advocate and support our institutions to be accountable and to the communities that we serve. And so again, I want to keep inviting us to think about what happens in our clinical interactions, and then also what happens inside of our systems and clinical institutions in which we're working, and the ways that our roles as providers and healthcare providers to shape that and to inform that. So I will shift now to screening and assessment tools. And as we're reviewing these tools, I would love for us to wonder together about how can we integrate maybe a whole tool or some of these questions into our clinical work together. So the SMART tool is actually a tool that was developed for organizations that are doing self-directed anti-racism work. And in our school-based health clinics, we've reviewed the SMART tool together and self-assessed our organization, including connecting with our HR, with other leadership, to really look at how do we rate how we're doing in terms of our own anti-racist work, and then beginning to make a plan and policies around it. Here's just one example of one of the questions, which is around strengthening partnership and alliances. To what extent does your organization work in partnership with the community and give constant consideration of the representation and inclusion of lived experiences? So take a moment to think about your own organization. Um, how would you rate on a scale of 1 to 5? What would you do differently? Right? It was a really powerful process for us to go through as a community, both in terms of aware of like, where are our gaps? What are the things that we are doing that we're doing well and that we can feel proud of and share and maybe elevate within our system? And what are the places? There were some places where it's like, oh, we didn't know we were doing that, but our larger organization is doing some of this, right? And so it's also a place of actually building some knowledge of things that are already inside of our institution into our clinics and into kind of more of our team members. And so this is a tool that I would invite organizations to use. Some screening tools more specific to clients and individuals is the racial trauma scale. And here you see some of the questions that are related to, think about the times when you have heard or seen or experienced racial discrimination. And as a result, how bothered have you been by the following? And I think this brings us back to, like, as mental health clinicians, our trauma mind or trauma knowing is like, one may experience a traumatic event. That does not mean that someone then develops traumatic symptoms or post-traumatic stress disorder. And there are a variety of factors that have people be more or less vulnerable or resilient. But what we want to know when we're treating people is both like, what were the experiences that they had, and then how is that impacting them right now today? And so you'll see some of the scale will rate, inabilities to stop moving, having difficulties connecting with other people, feeling like society is unfair, shifting perception, uh, anger, avoiding situations, avoidance, feeling less than, feeling like one can't succeed, impacting their motivation, and finding difficulty to cope, and worrying about one's safety. I'm just going to introduce a few other screening tools. Unrest, also developed by the University of Connecticut, UConn, the Racial Ethnic Stress and Trauma Survey. And the introduction in this interview it's really focused on trauma and stress related to racism, that sometimes people have very bad experiences that cause feelings of stress or even trauma. Some people have severe, difficult experiences over a lifetime that are manageable individually, but together they lead to feelings of stress or trauma. I want to ask you I want to talk to you about some of your experience of stress or trauma as it relates to your race or ethnicity. And then you begin to ask to describe what their race or ethnicity is. So this is another example of a tool, screening assessment tool that you could use in your clinical care. And then the last tool to share with you is the race-based traumatic stress symptom scale, which is also used for assessing the presence of stress and traumatic stress reactions for racial discrimination and racism experiences of racism. And this scale really rates these 7 areas of anger, depression, intrusive thoughts, hypervigilance, physical reaction, self-esteem, and avoidance. And this scale can also be self-rated or administered by the provider. And so we'll shift to some potential clinical interventions and clinical considerations when healing the impact of racism-based trauma. I want to share HEARTS, another acronym different than UCSF HEARTS, but HEARTS, which is Healing Ethno-Racist Racial Trauma. And the first strategy is around establishing sanctuary spaces. I go back to, the book, Why Are All the Black Kids Sitting Together in the Cafeteria? Um, and the importance of creating spaces, affinity spaces for children, for people by groups, and holding that, groups of people are not all the same, and yet they may share some shared experiences. Some of the ways we've done that in our work in our school-based health center is creating groups, specifically a DBT group for Black youth, a Voices group for recent immigrant youth, really bringing together people by identity and cultural identity and engaging cultural practices inside of that work. It is so important to acknowledge and create safe space for children, adults to process experiences of racism and racial discrimination. I think, so many times people may have that experience of something happening and having that, like, for children especially, to integrate that there's something wrong with me, right? That I am wrong. Not that there's something wrong with the system or that there's something wrong with um, how I was treated or how I see my friend being treated or my peers. It can really move people and it can impact their self-esteem, increase a lot of competition among when you have maybe a multiple people in a few people of one race in a classroom. That it's like, oh, if they're bad, then I'm bad. So I have to be different. I have to not be different than who I am. I have to separate myself from my cultural identity in order to be seen as good or worthy of connection, in order to be seen as worthy of love, right? So I'm thinking about how this really impacts especially younger children. Um, Being able to intentionally build coping skills and strategies, acknowledging the impact, and even strategies around regulation, talking about things that are happening and acknowledging what has happened. That acknowledgement is so important, particularly, if every teacher, I think, or if every clinician, if every doctor, when a child spoke about their experience, just validated, acknowledged it, and said, yes, that is real, what you experienced. How are you? What are you feeling? Let's put some words to your emotion. Again, drawing upon our clinical skills and validating that would make such a huge difference. Strengthening connection to family and communities, really holding that the impact of extended family, chosen family, who are the people that can relate, who are the elders inside of that community who can share the survival strategies and ways of buffering and protecting from living with discrimination. One specific project I'd like to share with you, one of our art therapists created a project of bringing grandmothers and high school students together to do a quilting project. And in that project, sharing about ways that they survive and buffer and manage stress. And it was all sorts of stress, but including, the stress of discrimination, the stress of living with poverty, how, and they created such a beautiful image that still lives in one of our high schools today. I've already shared a little bit about connecting survival strategies and cultural traditions that heal. One short story is also running into a community member and thinking about, how do we survive in these times? And she said that a group of elders also said, oh, what we need right now is belonging. right? And as long as we have belonging, like we're going to be okay, and how much of a relief that is. And so, what are those, knowing that there is survival and we can heal and we can be joyful and resilient, and how do we draw upon our cultural traditions that heal and our cultural medicines. I think about a client who was talking to his therapist, about different medicines that his family had taught him about, and how even drinking chamomile tea, right, was a way of connecting into some traditional medicines from their culture. And we also want to allow for like these traditions of liberation and resistance. There is a wonderful work, an journal article around healing interpersonal racial trauma by integrating racial socialization into trauma-focused CBT for African American youth, and that I want to share just a few learnings from that. Which includes, sharing culture, attitudes, and values to prepare youth to cope with stressors of oppression and oppression associated with a racial minority status, beginning to promote, and you'll see there's going to be a repetition of some of these, right? And so that we can hold, but promoting cultural pride by teaching and sharing cultural heritage. And that intentionally teaching of cultural heritage combats that negative messaging. If we think about, again, the smog of racism, and if we intentionally share, and this is where we see like a movement to really take that out of education right now. Um, you know, and it is so important to make sure that people have specific examples, from their cultural heritage, that can support and promote a sense of pride and well-being. That we promote children's awareness of discrimination and prepare them to cope with discrimination. Um, one pretty common thing that you'll hear about that is, Black parents talking to their children of what to do if they're pulled over. But there's so many other ways of preparing and thinking about, when discrimination happens, strategies to cope and to manage and to stay, in someone's integrity and dignity inside of those moments, and also to stay safe. Again, a repeated appreciation and involvement of extended family and chosen family, and providing cognitive and behavioral strategies to process interpersonal and racial trauma. And so that's, in the room, being able to acknowledge, again, notice, kind of connect that thought to emotion, to behavior, supporting people to notice where is it that they have choice, what is outside of their control, and what is inside and within their control. Where is their movement, agency, energy, and possibility? A few other clinical interventions is in making sure that we're considering context inside of our diagnosis, and our assessment, and that we're writing and speaking to the clinical, to the experience of discrimination and oppression as we're understanding the symptomology, that we bring in current events into our work, that we don't wait for our clients, particularly if it's not concordant racial and cultural experience, that we, as a clinicians, bring in, I noticed that this happened. How is that landing for you? And that we don't make assumptions about it. And then we let our clients tell us about their experience and how it is landing for them. That we continue to partner with young people, particularly adolescents, to solve the problems of today, and that we locate ourselves when presenting a case. And that's something that we've integrated into our clinical consultation, is addressing process, naming who we are, right? It's not just, oh, my client was a 16-year-old Honduran female, but I am, a middle-aged Black female, and paying attention to our cultures because it is in the room. And briefly, also creating a place for people to grieve and to mourn, to acknowledge the loss and the impact. And this, I would say, particularly both for our clients, but also for family members and for parents, when their children are experiencing discrimination and racism. We want to listen and recognize and validate their experience and consider the cultural expression of trauma, and also the cultural systems of care. Like, what are ways, and we may not know all the answers, but really can support our clients to mind their families and their communities and their friends. Like, how did people survive? How do you survive? Like, what are ways that people have dealt with this in the past? Um, we want to promote relational connectiveness. I want to say that, the importance of groups. We have a voices group that is, and voices, sorry, is a gender-based group for girls, that focuses on building coping strategies, and reducing, uh, difficult coping strategies. That was my short blurb around voices. But we have a voices group for girls, and really seeing how they are, the importance of that peer relationship and connection right now, especially post-pandemic, but I think always, especially for adolescents, and the ways that they are connecting and teaching and supporting one another. And then also holding that part of our job is to integrate resistance strategies, to think about our own social actions, to lean into liberation psychology, to um, know that there is a tradition of resistance, and that we're resisting harm. I think that's really, really what we want to hold when we're addressing racism or discrimination, and thinking about how do we help our own organizations and communities do better by creating safety and inclusion for all members of society, that there is a place of repair, and also, um, and I guess keep coming back to it, a place of repair and also a place of resistance, that is needed from all of us. Some resources for young people. These are two great books, the Racial Trauma Handbook for Teens and Healing Racial Stress Workbook for Black Teens. Um, really teaches a lot of relaxation, resourcing activities for, being able to relax before reacting or responding, community engagement activities, celebrating joy and cultural pride, building upon cultural spiritual strengths. And also part of one of the things I really love about these books, there's a piece here, is that really holding that we can heal from racial trauma and discrimination, that there is resilience and possibility, and that, holding that it is a long-term, it is an ongoing journey, but it is possible and something that we need to be doing all the time. This is some great work, Never Bother, which is specifically around crisis, and some suicide ideation and prevention. They, in developing this website, worked with adolescents of color. It has some really amazing resources for teens that reflect, that is reflective of who they are. And for caregivers, we really want support caregivers to build their own support network, to incorporate and share cultural comforts like food, music, memories, history, to acknowledge the harm of racism and the toll it takes on them emotionally, physically, uh, and relationally. We want to support caregivers to have honest conversations with each other, with their providers. As providers, we want to create safe spaces for caregivers to have those conversations with us. And we want to support caregivers by being proactive about celebrating cultural diversity, and preparing their children to cope and speak out, and also report acts of discrimination and microaggression and racism. And that's from the Child Mind Institute. I want to just also hold, as providers, as healers, we are also impacted. And so encourage us to increase support, reach out for consultation. CalMAP is a great source of consultation, that we're thoughtful in our documentation, that we engage in ways that resource us. There's healing justice, and mental health decolonization frames that are really important, and invite us people to look for those. But keep paying attention to how you are healing, and what you are remembering. And I think the last part I want to share again is that ACEs are not destiny, and healing is possible and ongoing and needed. And really grateful for, on this day, February 12th, 2025, how many more resources that we do have available, how much research there has been, and also just for the ways that communities circle around and support one another to keep accessing kind of well of healing and wellness and resilience. The rest is a lot of resources, so I'm going to pass it. I'm going to stop the share and pass it back to the CAP team.